Thank you, Ceann Comhairle.
Wait now, we've had that question. Can we go ahead with Deputy Pringles, please?
Thanks again, Ceann Comhairle. Taoiseach, as you know, a total of 39,603 job seekers were referred to Jobpath in the period of July 2015 to June 2016. In those 2 years, a total of 8,340 people gained employment, a success rate of 25%. Those who gained full-time employment amounted to 6,111 people, or 18% of the total figure, while those who gained part-time employment made up 4% of the total number. When you look closely and measure the chances of someone gaining full-time employment on the Jobpath, as opposed to on their own accord, the numbers get very interesting. The most recent figures for 2016 show that Jobpath's impact only helped a further 2% of individuals gain full-time employment. Figures for people who gain part-time work do improve, however. Part-time work is often seasonal, precarious and low-waged. Because of this, the state often steps in to subsidise income through the Family Income Supplement, Part-Time Job Seekers Benefit and Job Seekers Allowance. So the question must be asked, Taoiseach, as to why we will continue to pay a private company for which has only served to continue the situation of income insecurity for people which the state must subsidise anyway. I would like Taoiseach to read an excerpt from a letter someone gave to me in Donegal about their experience with the company People First, who is so intimidated by the service he wishes to remain anonymous. He says, "I am a client of People First, and I have found my time now to be a very difficult one. The advisors put a lot of pressure on me. I feel extremely stressed and made feel worthless. I try very hard to find employment, but I can't seem to get any work. I find my advisor to be very disrespectful, discouraging and not understanding of my circumstances. Although I have a third-level qualification, my advisor seems to put across that I am lazy. I have approached the manager on a few occasions regarding my complaints, however it is not dealt with." The letter aptly describes the direct consequences of privatisation of our state services as having on vulnerable people across the country. The profit-driven model of these private companies applies unnecessary pressure on people. This should be treated as a state service, and yet your government pays these companies €58.5 million in last year. Money which could be spent on 500 houses in Donegal, 5 or 6 schools, or indeed reinstate social welfare income supports for part-time and seasonal workers to the 2012 levels across the entire state. Your government is blinded by the notion that private services are more efficient, when clearly the figures show this is not the case. Taoiseach, will you shut down Jobpath and instead reinvest the money into state services and move away from the encroaching privatisation of social service provision in this country? Thank you.
Thanks very much, Deputy. We've gone from a situation in Ireland where only 5 or 6 years ago we were in the middle of an economic crisis and an unemployment crisis. 15% of people unemployed and people being forced to emigrate once again, to a situation now where we've net migration, more Irish citizens coming home than are leaving, and unemployment down around 5%. We will soon reach full employment, the point at which there is a job in Ireland for everyone who genuinely wants one. And we're almost there, and that's enormous progress in only a few years now. That didn't happen by accident. One of the things that was remarkable about Ireland's economic recovery is that we had jobs growth and a fall in unemployment almost from the start of that recovery. Most countries that have an economic recovery see the economy recover first, but jobs coming later and unemployment falling thereafter. And the reason why that happened was because a decision was taken by the last government, of which I was a member, Fine Gael and Labour, to adopt an activist approach to getting people back to work. And that's why the intro model was set up. It's why Jobpath was contracted by my constituency colleague, Deputy Burton. It's why we continue to support the local employment schemes, because some people will just find a job on their own, but other people need help and support and encouragement and training. And that's done through different mechanisms. Intro, which is the in-house service provided by the really excellent staff of the Department of Social Protection around the country. Jobpath, which is outsourced because the department didn't have the capacity at the time of mass unemployment to do all of the work, and of course the local employment schemes around the country. And it has been successful. And the Jobpath model is a payment by results model. The companies only get paid. They get a registration fee, but beyond that they only get paid if the person they're working with enters gainful employment and stays in gainful employment for more than 3 months. There is a contract. Obviously, terminating any contract with any company involves significant costs and penalties for the taxpayer. So we're certainly not going to cancel any such contracts. But what I will say is that we are entering a different phase in our economy, where we're heading towards full employment. So obviously, services like Jobpath may not be needed in the future, but that's an assessment that Minister Doherty will have to make, because I think in the future the focus will be less on people who are unemployed, because unemployment is down so far, but more activating and encouraging into the labour market people who are not on job seekers benefit or job seekers allowance. In terms of the complaints process, I would very much encourage anyone who has a complaint to make that complaint to the provider, and if they're not satisfied with the response, they can make the complaint to the Department of Social Protection, which will investigate it. And when you look at the tens of thousands or hundreds of thousands of people who have been involved in the various programmes that the Department of Social Protection runs, the percentage of complaints is reassuringly low.
Thank you, Taoiseach. Deputy Pringle.
Taoiseach, there's no doubt that things are improving and people are getting jobs, and that's welcome. But the point I'm making is that despite you spending €58.5 million last year on Jobpath, it actually is not creating any significant extra jobs than people are getting themselves. Your own figures, the Department of Social Protection data shows that right here, and that's the figures that you have. The Jobpath, we spent €58.5 million to get 4% extra jobs created. That, to me, is not good value for money. And even for you, as privatisation and feeling that the private sector works, you surely would think that that's not good value for money. And even from your point of view, value for money point of view, that doesn't work. So the point I'm making to you is that this system isn't working, it hasn't worked, and you should accept that it hasn't worked, because it won't work in the future either. And the simple thing is that people will find jobs if they get the support, and you have the staff already there within the Department of Social Protection to actually help and support those people. You don't need to privatise it, so why are you continuing to do it?
Thank you, Deputy Pringle. Taoiseach, to conclude, please.
Deputy, we have the staff now. There are lots of staff in our intro offices around the country, but when unemployment was 3 times what it is now, the Department and the Government didn't have the staff, and that's why Jobpath was brought in as an additional provider, providing these services to assist people to get into employment. But the context is now changing, and we need to use those kind of models in other areas. So, for example, we use a similar model with the NTPF. In areas where we don't have the capacity, such as our public health service, we've used the NTPF to bring down waiting lists significantly. We've seen waiting lists for people who need operations or procedures in our hospitals, hip size, knees, cataracts, angiograms, all of those things falling every month now for nearly a year and a half, lower than it was when this government came to office. And that's because we used the private sector to augment our public services. And it makes sense to do that on occasion. If it had even been possible to take on hundreds or thousands of extra staff to the Department of Social Protection during a period of high unemployment, what would we do with them now? Would we be letting them off? So it makes sense to provide public services through the public sector, and on occasion to augment it with a private provider.